What is good, everyone? My name is Tristan, and in today's video, we're going to be going over my experiences with CAR T-cell therapy. So before we actually begin, I wanted to talk about what exactly CAR T-cell therapy is. And the thing I usually tell people is that they go in and take my T-cells, they send them off to a lab, bioengineer them, and then give them back to me. And that's pretty much the simplest way I can put it. But what's essentially happening is that my T cells are getting supercharged so that they can not only recognize, but kill the cancer cells that are present. Pretty futuristic, if you ask me. Now, something actually needs to happen before an individual can receive CAR T-cell therapy, and that is if they fail 2 standard cancer treatments. What I mean by that is, for example, chemotherapy or immunotherapy like me. For those of you who do not know, I was diagnosed with diffuse large B-cell non-Hodgkin's lymphoma in March of 2021. And after 8 total rounds of chemotherapy, my tumor had actually grown again. It did respond to the chemo. It just didn't respond as much as we wanted. Now, the next step was actually immunotherapy. I had received, 14 total treatments of that over the course of a little under a year. And towards the end of that as well, the tumor grew again, once more. At this point in time, we are looking for answers, looking for options. Thankfully, we had 2 other options, and that was either a bone marrow transplant or CAR T-cell therapy. And of course, we opted for the therapy. I was actually placed under the care of a new oncologist at the University of Pennsylvania, which just so happens to be the same place they invented CAR T-cell therapy itself. So we meet up with this new doctor, go over everything about CAR T, and then finally make the decision that we want to get it done. The first step was the apheresis appointment, where they take my T-cells. But before that, I actually had to have a consultation regarding the veins in my arms. They essentially wanted to see how good they were because you need 2 lines for this apheresis appointment. One going in and then one going out. That's actually taking your T-cells. Because if not, I would have had to have a line in my neck for the 5 to 6 hour procedure. Thankfully, my arm veins are good, so they didn't have to do that. The whole appointment honestly went off without a hitch. I mean, I was actually asleep for probably the majority of it, probably like 4 hours, I would say. They took my T-cells. I think it took them maybe like a month to like fully bioengineer them. I honestly don't fully remember. So while we were waiting for the T-cells to be engineered, my new oncologist thought it was a good idea for me to get low-dose radiation therapy. Now, this is not the same strength as normal radiation therapy. It's a lot less severe, actually. He thought it'd be a good idea to hit the tumor a little bit in preps for the CAR T-cell therapy. Kind of like a bridging therapy. Not kinda, that's actually exactly what it is. Yeah, I got 5 total treatments of low-dose radiation therapy. I had to lay down on a table 5 days in a row for about 10 minutes. I had no side effects at all. You're not really supposed to have any significant side effects with low-dose radiation therapy. At the very least, I think they were telling me maybe my throat was going to get kind of dry feeling or like sore feeling. Sorry, my throat specifically because my tumor is in my chest and it would kind of like hit the structures around there. So yeah, I got the low-dose radiation therapy done. There's one more thing to do before the actual CAR T-cell therapy, and that was to get conditioning chemo. Now, what this conditioning chemo is literally making room for the new supercharged T-cells. They were killing off some of my good cells literally to make room. That's the way they explained it to me. I guess it does make sense though, now that I think about it, because they wanted the supercharged T-cells to be the dominant force in my bloodstream. Getting CAR T-cell therapy actually requires you to stay at the hospital for, I think, 7 to 10 days. So we knew that going into this. In the process, though, we had actually heard of this place called Nick's House. It is a charity house dedicated to cancer patients getting treatment in the Philly area. And because it was a charity, it was free of admission fees, which is awesome. My parents were living there during my stay at the hospital. It's not just one family, though, that can stay there at a time. It's multiple families. It's a pretty big house from what my parents were saying. I could not go in there. More on that later. It was actually because I had COVID. Yeah, I literally got COVID right before my CAR T admission. And thankfully, they did not really mind. Well, I guess it just didn't really mess anything up. I could only have one visitor a day, which was usually my mom. Shout out to my dad, though, for always waiting in the... I was going to say lobby or like waiting room, but UPenn is a massive hospital. So thankfully, he had some options to cure his boredom. All right, let's talk a little bit about my hospital room. Now, being on the oncology floor, I suppose oncology patients get larger rooms to begin with, but this one was insane. The TV was probably 80 inches. Bathroom was very nice. The window, oh my gosh, the window was very, very key in keeping my sanity from having too much cabin fever, since I couldn't leave the room. I had COVID. I was on COVID precautions. So that big window really helped that out a lot. Okay, so the plan for getting the CAR T, I was to get blood work on the first day of admission, and then the following day, I would get the CAR T cell therapy infusion. They were telling me it's literally just a 5 to 10 minute infusion, and then after that, I am closely monitored for any of the potential symptoms. So here's a little clip of me actually receiving the CAR T cell therapy. If you guys can see that little tiny white bag, those are the supercharged T cells. The machine in the hallway is actually used to warm them up so that they're not... I don't know the reason. I'm sure it feels better when they're a little bit warmer, maybe because they were frozen or something. But yeah, rather anticlimactic. I remember watching it like fall and then like go in my line, and I was watching it go in my arm, like just not knowing what was gonna happen. Once the infusion was over, I remember feeling honestly prepared for anything that was going to come next. I remember the nurses talking about cytokine release syndrome, or CRS for short. Now, essentially, CRS happens because once the CAR T cells are infused, they actually start to go to work like as soon as they're in. And all these like new cells in the body attacking the tumor cells that are dying actually release a bunch of cytokines. And cytokines are, I mean, they're kind of similar to hormones. They're responsible for initiating like different processes, I guess. They essentially have an effect on other cells. And with that massive influx of cytokines from all that cancerous tissue dying in the beginning, the probability of getting CRS is pretty high. They actually gave me this wallet card that talks about a lot of the symptoms. It's a patient wallet card. You're supposed to have it with you at all times. Show it to any doctor that sees you. It's probably because CAR T is like so like not crazy, but like I don't know, it's a big deal. So some of the symptoms that CRS induces is difficulty breathing, fever, chills, shaking, confusion, nausea, vomiting, diarrhea, severe muscle or joint pain, very low blood pressure, dizziness or lightheadedness, and a headache. Now, fortunately for me, I only dealt with fevers and some headaches, so not too bad. However, the fevers were very frequent for me. I believe in my 9 or 10 day total duration, I experienced 11 fevers. Yeah. The fevers themselves were honestly not too bad. I remember getting one at like 2 in the morning, and honestly, I wasn't sure if I actually had a real fever or not. But I was on vitals like all the time. I was on blood work all the time. Like Q6, I want to say, every 6 hours. But yeah, other than that, I was chill. Um, I mean, I was chilling. But yeah, so another big thing with CRS is mental checks, like mental changes. I mean, and then the nurses had to perform mental checks. I think it was like every 8 hours, the nurse would come in and ask me, "What's my name? How old I am? Where am I?" I had to give them the exact location. Like, I'm in UPenn at Philly in Pennsylvania. They used to ask me to count down count down to 0 starting from 100 backwards by 10, and I would just be like 190, 80, 70 every time. I never had any mental changes, thankfully. That's probably a very weird thing to experience, and I'm thankful that I didn't have to go through that. My favorite part, though, about the mental checks was the sentence, the daily sentence. They had me choose a sentence, and I was to write it every day night shift, I think. But yeah, that's a pretty funny thing to look at. I literally still have it, just because pizza is indeed a great, tasty invention. Oh, I almost forgot. Another symptom I had was this rather peculiar eye thing going on. Basically, my eyes got super puffy to the point where it looks like somebody beat me up in my sleep. It was weird. They didn't hurt. They were not itchy. I could see completely fine. It just randomly happened. That happened for. They stayed that way for like 3 days, I want to say. They brought in an eye doctor just to check, make sure everything was good. Everything was good, thankfully. Oh, let me take a moment to talk about the hospital food. So, when I first got there, they were telling me that UPenn is revered for having like good or great hospital food. Um, in the beginning, it was interesting because I had a menu and I could call down. Well, no, they called me every day for my order. I could order off a menu, which was awesome. Having the option to choose what you want off of a pretty large menu was great. The only thing that was not great, though, was most of the food, honestly, and the fact that every time I got it, it was either lukewarm or cold. Can't really help it, I guess. It is what it is, but I remember there was a span of like 3 days where this is I don't know. I'm just gonna go with picky. It was pretty picky of me to not eat solid food for 3 days, just because I didn't enjoy it that much. I was literally on a liquid diet. I put myself on a liquid diet because the food was just so bland and cold, and I hated it. Breakfast was probably the only palatable thing, which was nice. But yeah, my parents would bring me food from the cafes downstairs every now and then. Those were a pretty large pick me up, if I do say so myself. Thank you again, Mom and Dad, for that. Yo, hold up. This mac and cheese, oh my gosh. When I was only drinking protein shakes, my nurses clearly saw me, and she offered me Stouffer's frozen meals, specifically mac and cheese that they had that they could warm up in the microwave, and they would get it to me when it was done. And I was like, "You guys actually have that? You're not messing with me, are you?" And I ended up getting it, obviously. Sorry, I'm like in a trance. Like, I'm literally thinking about how that made me feel in that moment when I took my first bite of steaming food for the first time after like a week. It really brought my morale up, for sure. It's funny how mac and cheese could do that in that moment, but yeah. All right, so the requirements for discharge. I was to have no fevers at all, or no fevers, no symptoms at all for 2 days straight. I couldn't use any. Oh, sorry. What they would give me for the fevers is Tylenol, and that usually helped me every single time. I couldn't have Tylenol during those 2 days because they wanted to see like how bad or like how much the CRS would occur at that point. And thankfully, I was good. I was chilling the last 2 days. I was eating solid food again. They were pretty much, yeah, they were working towards getting me home, or getting me out of there rather. So I'm finally feeling better. Here's a little clip from, I think, day 8 or 9.
It's like, nah, what's good, everyone? It's been officially a week since I've been in this hospital. I got the CAR T cell infusion on Monday, and it's been pretty good. I mean, I've had probably 10 or 12 fevers so far from it. One of the main, I don't even know if I've mentioned this yet, but one of the main side effects is cytokine release syndrome. And that comes with a bunch of other stuff, but my main side effect was, those fevers. Thankfully, they haven't been too bad. In recent days, they've been getting a lot better. My last one was midnight. Excuse me. My last one was midnight, and I think my temp was like 102.7. When the fevers first started happening, my head would like be pounding. I would get these bad headaches. Right now, my headaches aren't too bad, thankfully. So yeah. I have to go 48 hours without any symptoms or side effects until I can be discharged. But today's looking good so far. I mean, my last fever being midnight and nothing yet today is pretty good for me so far, so it's only a matter of time. Thanks, guys.
So you guys remember Nick's house from earlier? The charity house that I couldn't go to? I don't know if I mentioned earlier in the video, but I couldn't go because of my COVID. Now, I was getting blood cultures towards the end of my duration, the end of my stay, for probably like 3 days in a row. I was getting blood cultures so that they could examine my viral load of the COVID that was still in my body. But it was weird because I had just gotten the conditioning chemo, and it messed with, I don't know, it messed with like my antibodies in a way that the COVID's viral load stayed there for longer. I kind of forget what it fully was, but it was something along those lines. And because my viral load was still present, Nick's house did not want me to stay there, and obviously I didn't want to bring harm to anyone, so we couldn't go there. Now, this was a little hiccup, to put it lightly, because we didn't know where we were going to stay after my admission. I forgot to mention this earlier, but after you get CAR T cell therapy, you're supposed to stay in I think within like an hour or so of the hospital just in case anything happens. You're supposed to stay in that proximity for, what does my card say? I think it said, yeah, at least 4 weeks. So yeah, we actually ended up getting an Airbnb. Shout out Robert for helping us last minute, working with us. You were great. I don't really have too many photos or videos. I don't have any at all, actually, of that place. But we lived there for, I want to say, 2 to 3 weeks. It went off without a hitch. I did not have any symptoms, thankfully. I was doing great. We were pretty much like going around Philly and just eating at all the good spots. This is Han Dynasty. I was actually there a few days ago. This is Angelo's Pizza. Good pizza, very, very pretty looking pizza. My only downside is that I was literally fighting the slice to take a bite. I don't know if it was just that batch that day, but... And finally, we make it back home. Probably a month total in Philly, and then we got back sometime a little bit before Thanksgiving. I remember getting back and just cooking like... I cooked like every day for like almost a week straight, I swear. I had a great time coming back home, seeing my family again, seeing my niece, my sister, and brother-in-law. They actually visited us at the Airbnb for a day, which was cool. Fast forward to now, literally a year later. Yeah, I'm recording this on October 29th, 2023. And I got CAR T-cell therapy probably October 24th or 25th of 2022. So this video is pretty much a year later after I got the CAR T-cell therapy. And I've been doing great, honestly. I've been feeling good. I've had a couple PET scans, I think January and then April. Those update videos are on my channel if you want to go watch them. But yeah, pretty much mostly so far so good. Which brings me to our current update. The update of October 2023. I actually had a PET scan 2 days ago. Is it 2 days ago? Sunday? No. Well, yeah. I got it on this past Friday, and it's looking pretty good. This is the first PET scan that I've ever gotten where it hasn't lit up and it hasn't growed. Both of those things at the same time. In the past, it's shrunk before, but it would still light up on the PET scan. This is one of the first ones where it's not lit up, which is crazy. Like I don't think it's hit me still, honestly. Another thing though, I do have 3 lymph nodes in my neck that are lighting up. My oncologist does not think it's any lymphoma. We are actually relating it to either a cold or some kind of virus I had earlier this month. I remember having a sore throat on October 2nd, and that sore throat escalated into mainly just a cough and not really a stuffy nose or anything. I remember feeling a lot of like phlegm in my chest. That lasted for probably 16 days. So yeah, that's what we're relating it to right now. There is talk of potentially biopsying one of the lymph nodes in my neck, but we're not even sure if that's entirely possible right now due to it being such a tender spot, such a vulnerable spot, I guess. There's a lot of nerves and blood vessels, and the lymph nodes are really tiny, which would already be a challenge to get a sample with a needle, so we'll see. My doctor was saying he would talk to radiology and get their opinion, but I honestly don't think I need one. I really do not think it's cancer either in the lymph nodes. My oncologist was saying that as well because my type of lymphoma that resides in my mediastinum, a lot of the times this does not migrate to anywhere else. And patients who have had a history of it migrating it would normally go to a lymph node, but I haven't had a history of that, so I should be good. But yeah, that's pretty much it. The whole year summary, and then the October update. If anyone has any questions about anything at all regarding this video or just me in general, feel free to shoot it down below and I'll get to you as soon as I can. Thank you guys so much for watching. I had a good time explaining and reminiscing about this crazy past year. Thank you guys, and I will see you next time. Peace.